Hello everyone, and thank you for joining us for our monthly webinar series. If you've ever visited Charlotte Plastic Surgery before, on your screen you're going to see just a few little items we'd like to share with you. We were established in 1951. We're actually celebrating our 66th year serving the Charlotte community. We actually now have 6 nationally and internationally acclaimed plastic surgeons who are continually recognized by local and national publications and media outlets. The newest physician is who you're going to hear from today, Dr. Jack Scheuer. We're actually the only plastic surgery group in Charlotte to ever win a Charlotte Magazine Bob Award. We're very proud of that. And we have an extensive team of experts from our doctors, but also our registered nurses, surgical techs, and customer service staff trained by the Ritz-Carlton. So if you haven't met us yet, please come and see us. Every month we do a different Your Best You webinar series, so I hope that you have joined us in the past, and if not, that you tune in next month. This time we're going to be talking all about mommy makeover surgery with Dr. Scheuer. He, again, is our newest physician here at CPS. He was hand-selected by our existing team of surgeons for his high skill level and surgical expertise. He was trained in the highly competitive general and plastic surgery residency programs at University of Texas Southwestern. And if you're not familiar with that program, it is actually one of the top-ranked plastic surgery training programs in the country, so we're really honored to have him with us. He also completed an aesthetic surgery fellowship at the prestigious Manhattan Eye, Ear, and Throat Hospital while training with other world-renowned plastic surgeons and running his own aesthetic surgery practice. And his background is in breast and body procedures. He also does face. He really does it all. But his specialty is just providing natural, beautiful results. So we're going to go ahead and get started here today. I wanted to make you aware of some of the things that we'll have going on. You'll have a Q&A portion at the end of the talk, so you'll be able to ask us questions, ask Dr. Scheuer everything you'd like to know. We'll also be sending you a video recording of the presentation. It usually goes out about a day after the webinar is completed. We're also going to be giving you a special offer that will be at the end of the webinar just for attending, just to thank you for being a part of it. And then we would love for you to let us know how we did by providing us feedback and answering any of the emails that we send out to you after the presentation. All right, we're going to go ahead and get started. I'm going to turn it over to Dr. Scheuer, and again, we will see you at the Q&A portion at the end of the talk. Thank you.
Okay, well, first off, I want to say thanks for tuning in. Today I'm going to talk about mommy makeovers. That's one of the more common phrases you'll hear when people talk about plastic surgery. People always ask me, what is a mommy makeover? And in my mind, it's generally a combination of a breast procedure and a tummy procedure, but truthfully, it can be anything that encompasses the rejuvenation of a mother. But this is what most people think of when we talk about, mommy makeovers. So as we all age, the body undergoes a bunch of changes, and there's many factors that play into this. One is sun exposure. Your genetics play a large portion of how you're going to age and how you're going to heal, for that matter. Your lifestyle, type of job, weight loss and weight gain obviously can change the way the body is shaped. And then childbearing, which is one of the milestones in a lot of people's lives that is a very happy time. And also, once they're done childbearing, the body can still have some changes that persist. When we're pregnant, the breasts increase in size. This is anticipation for breastfeeding after the baby's delivered. And the breasts get larger. And you can imagine you have glandular tissue, means the portion of tissue that makes the milk, and the overlying skin that houses everything. So as this enlarges, you can get some stretch of the skin. And then once you cease breastfeeding, the breast tissue itself gets smaller again, and sometimes the skin shrinks back to its normal size, or size it was before before having your child, but a lot of times it doesn't. And when it doesn't shrink back, the skin can be looser than it was before, causing the nipple position also to descend. So the breast can sometimes have somewhat of an inflated appearance, as you can see in this picture. You can see that she's lost some of the volume that she had prior to pregnancy, and the nipple's in a lower procedure than it would have been otherwise had she not had kids. These are some of the changes we just talked about. So what are the options for rejuvenating the breast? If you only lost volume, like we talked about, this can be solved with a breast augmentation. And that means basically placing a breast implant. Now, if you've lost volume and you've had some nipple descent, that requires, the replacement of the volume, which would also be with an implant, but a lift also, which is called a mastopexy. These can be done at the same time, or they can be done at different procedures. And there's different indications for staging it, meaning doing it at different times, and different indications for doing it at the same time. So, and that's going to be up to you and your surgeon. There's also patients that have adequate volume, but their nipple has descended into a lower position. And these patients, if they have adequate volume, mainly just need a mastopexy, meaning like we talked about, a breast lift. And here you can see that same patient we talked about earlier. And her nipple position is not too much lower than it would have been beforehand, but she does have a loss of volume. So all she ended up needing was just a breast augmentation, and she had a very nice result, as you can see here. However, on the other hand, this patient's nipple position on the breast mountain was lower, and she desired to have more volume as well. So she ended up having an augmentation mastopexy, as you can see here, meaning she had a breast lift and an implant placement, and she had a nice result. So people always ask, there's always talk about the different types of breast implants out there. So not to get too in-depth in this webinar, since there will be another one in the upcoming months on breast augmentation itself, but generally there are two different main classes of implants. So there's silicone implants, which are filled with a silicone itself within a silicone shell, and there's saline implants, which are basically a silicone shell filled with saline or salt water. And these types of implants can vary in their profile, meaning how much they project off your body and how wide they are. So that just basically is, and then most people talk of implants in cc's, which is the volume. So this is sort of another way of looking at the implants, their sizes. There's also different types of implants. A lot of people always ask about the gummy bear implant. Those are usually are more firm gel or cohesive gel. That means that the gel is more it sticks together a lot better than a less cohesive gel. And the anatomics are the gummy bears that are teardrop shape. So that's what people refer to the gummy bears, or the teardrop shapes, are referring to the anatomic ones. And then there's textured versus smooth. And here's a picture that sort of illustrates that. This is a textured implant here we have on the right, which has a more rough texture to it, and then you have the smooth implant. And depending on what you desire, your goals can be discussed with your plastic surgeon. You can discuss what type of implant to use if an implant is indicated or is something you desire. Now, with the tummy, the same thing happens when you're pregnant. The skin accommodates the growing baby along with the abdominal muscles. And overlying the abdominal muscles, or your tummy muscles, the ones that make a six-pack, there's something called fascia, which is a very thick, fibrous covering. And all of these layers of the abdominal wall stretch to accommodate the growing baby. And this is an illustration right here. As you can see, this fascia, this white, almost broad band here, overlies these stomach muscles. Okay, so they're trying to demonstrate here that, beneath this fascial layer right here in the middle, there's your stomach muscles are present. And then in the middle is just a layer, or is a condensation of this fascia. So if we were to do a cross-sectional area of this diagram right here, you can see what I was talking about. This area right here is between your six-pack muscles. This is your six-pack muscle on this side and this side. And this is this layer of fascia right here over top everything. Now, when you're pregnant, or actually after having your baby, and like I said, when you're pregnant, this layer of fascia can be stretched, and that's normal. That's to accommodate the baby. And you can see right here the difference in this middle layer of the fascia. And that's what makes room for the baby when he's growing. And you can see that there's more area between the two muscles right here, okay? And we call that a diastasis. And the terminology is not as important as the concept, which means that now the stomach muscles are in a different position. They're more lateral, meaning more farther outside towards the hips than they were prior to having a baby. Now, this doesn't happen to everybody, but this happens in quite a number of females. And this can sometimes lead to that pooch that they have difficulty getting rid of after they have a baby. And here you can see it right here. This is what I was referring to. This is that widened line in the middle on the previous slide here. And you can see, excuse me, in this patient right here, this is that diastasis we talked about. So what are the options for your tummy? And one of the main ones is a tummy tuck, and that's, we call it abdominoplasty. And what that does is that removes the excess skin, and it tightens that fascial muscle, that fascia covering the muscle. So that area is wide in the middle. What it does is it brings the stomach muscles back closer together. We tighten that area, and so we're really repositioning the stomach muscles and tightening the fascia. And that's when people say, you know, I got my stomach muscles tightened. That's really what they're referring to. Is the muscles are repositioned, and the covering of the fascia, or the covering of the muscles, the fascia for that matter, has been tightened so as to reposition the stomach muscles. And this is sort of an illustration right here. You can see the fascia in the middle is widened, which is very common after having children. And then this is sort of a post-operative diagram, what happens beneath the skin, where that widened area has now been stitched so that it's more narrow. And so now we're going to sort of put it all together here. We're going to talk about the breasts and the tummy together and sort of give you some pre and post-operative results. So this is a patient who has loss of volume, and she has the changes that we talked about in the tummy, where she has some loose skin and she has a diastasis. You can't see it here, but she definitely does. And what she had was basically a breast augmentation and a tummy tuck. And this is another view of her there from the side. You can see the dramatic change in her abdominal contour, as well as her breast volume, for that matter. This is another patient that had similar issues after having children. She had lost some breast volume. Her nipple position was in a lower position than she liked. She had some loose abdominal skin, and she also had some diastasis. So she underwent a breast lift with an augmentation mastopexy, like we talked about, and a tummy tuck. And you can see this, the scar from the breast lift right here. It's faded over time. It's barely noticeable. And then her tummy tuck scar, or abdominoplasty scar, whichever you prefer to call it, is down here, hidden in undergarment line. And then she has a scar around her belly button. And this is a side view. This is another patient who had the diastasis, or the weakening, or sorry, the widening of the abdominal fascia, or the layer of the abdominal wall we were talking about earlier. And she underwent a tummy tuck, and you can see her scar is down here in the undergarment line. There's her scar around her belly button. So there's a bunch of questions that we always get asked, and they're good questions. One of the questions we always are asked is, who's a good candidate for these procedures, doing them both at once? And I tell patients that we find that the best results are in patients who are highly motivated, they're healthy, and they exercise, that have lost the weight and their goal weight. They're not in the process of still losing weight. And also, if they're at their goal weight, they've been at that same weight for 3 to 6 months. And a lot of these patients want to look like they feel, and that's one of their things they always talk about in the consultation, is how they want to look their best and feel their best. So I think that's something that these procedures readily achieve. Another question is a lot of patients want to know if it's safe to have both procedures at once. And yes, but always under the right conditions. You know, there's always a good way to do things and the wrong way to do things. So you always need to make sure that you're set up for success. And some of the patient factors are, like we talked about before, are making sure that the patients are healthy. If they do have medical conditions, they've all been optimized. So they're at at their peak level. You always want to go into any surgery, not just plastic surgery, with a good level of nutrition, because that's very important for healing. And since these procedures can be on the larger side of procedures, you want to make sure that you have a lot of assistance at home afterwards, at least for the first couple of days, because that's important to make sure that, you know, that you're going to have some help. And like we talked about before, some of the other factors, you know, factoring in whether it's safe to have it done all at once is your surgeon. You know, you want to make sure your surgeon has experience doing these procedures, because it is a lot of work and it takes, you know, a fair amount of time. The facility, you want to make sure that they're prepared to do these procedures, that they have the staff on hand, that they have everyone available that used to be, and then also that you want to make sure that, you know, the anesthesiologist or CRNA, whoever's providing anesthesia, is very experienced. A lot of patients ask, you know, they say they've seen their friends who've had tummy tucks and they had drains afterwards. And drains are essentially some silastic tubing that basically exits through the surgical sites or close by. It drains off excess fluid during the procedure, and these usually come out between 7 and 10 days. And you know, some patients don't mind them, and others are very uncomfortable with them. So I tell patients it's not necessary all the time to have drains, but there are some times where I feel like it is the best route to go, and there's other times where it's not necessary. And a lot of that will depend on the type of procedure performed and the techniques used to achieve your final result. One of the ways that we're able to omit the use of drains is through a technique called progressive tension sutures. We're not the only ones to do this, obviously. This is done all over the world, but that allows us to, in certain situations, to not use drains, which I know many of the patients appreciate. Patients are always concerned about the level of pain after the surgery, because when you do tighten the stomach muscles or tighten that fascia, like we talked about earlier, it can be very uncomfortable. So in our practice, we use a medication called Exparel, which is essentially an anesthetic, a local anesthetic that we inject into that abdominal wall, the area that we're operating on. It provides some increased pain control. And I tell patients, hopefully it lasts up to about 3 days in my experience. So, but generally after once it does wear off, some of that pain will return, but the most acute amount of pain, or the worst amount of pain, is usually in that first 3 days. So that generally gets patients over the hump, and they do quite well after that. So I think that's one of the things that really helps people with this surgery that we now have available to us that we didn't in the past. Patients are always curious about the scars, and we sort of showed those earlier in regards to the breast and the tummy, but we'll go over them again, and we'll start off with the breast. To do a breast augmentation only, that can be done with smaller scars that are usually either around the nipple or under the breast or in the armpit. Now, to do a breast lift, if the nipple doesn't need to be moved very much, you can always do a circle incision around the nipple. Some people call that a donut lift. You know, a lot of patients are not great candidates for that, but there are some that are. So that's one of the incisions. Another one is if you need to move the nipple a little higher and you can get a little more lift. This is sort of a combination or a lollipop incision that we or the patients sometimes refer to it as. And here's another variant of that, and this is sort of, we call this a J incision, and this provides the same sort of principles as the other ones, where it gives you some lift of the nipple. And this is the, patients call this sometimes the anchor incision, and this is a very common one used, which helps to really remove a lot of the excess skin and position the nipple where the patient would like it. And this is a patient that was a candidate for an augmentation mastopexy, so a lift and enlargement of the breast, a prosthesis or an implant. And you can see she had the anchor scar, and even though that's the largest scar, it's still barely visible. As you can see, the only portion that's easily visible at this point is the vertical portion, but even then it's difficult to see. One of the more visible scars for abdominoplasty is not so much the one that goes across the belly down lower in the undergarment line, but is the one around the belly button itself. So this is sort of a close-up view of the belly button scar. And generally these heal pretty well. So, but this is usually, if the incision is able to be kept low enough, the only scar you see from the tummy tuck procedure. And this is sort of a zoomed out view. As I was talking about earlier, you see her scar is down in her pain line, but it's barely visible because it's well hidden. The only thing that's really visible is this scar, if you're able to really discern it around the belly button itself. Tummy tucks are also good for patients who've had previous abdominal surgery in the past and have a scar they're unhappy with. This is a patient who'd had a previous surgery in the past, and you can imagine she was not thrilled with that scar. She actually had one that went across the belly lower, and you can see the vertical scar there. So one of the benefits of a tummy tuck is we remove a lot of the skin between her belly button and sort of this suprapubic area. So when we do that, you can see in her post-op results, the scar that was vertical is now gone, and she's traded this horizontal scar probably for a little bit of longer horizontal scar, but still, it's a little bit lower now and it's well hidden, and she has a beautiful result. And there are some techniques that can be used to improve your scar. One of them that people employ a lot is taping the scars or applying pressure to them, and this is done over a series of weeks to months. Another one is using gels or some sort of topical, and that's employed as well. And another one is placing silicone or some sort of a silicone product over the scars themselves to help them mature. One of the other things that's available to help visualize postoperative results is a 3D imaging system. It's called Vectra. And what this does is this allows patients to see the best way to say is the post-operative, or hope for post-operative results before the surgery is done in regards to an augmentation, which involves placement of an implant, or a breast lift and placement of an implant. And these are just a demonstration of a typical Vectra post-operative, or sorry, pre-operative consultation, what a patient would see. So a lot of patients want to know what the recovery is like. I tell a patient they generally need 2 weeks off work. Like we talked about earlier, they'll need some help at home, at least initially. Now, in regards to wearing a bra, every surgeon is different. I tell patients typically they will need to wear a bra full time if they've had an augmentation mastopexy for about 6 weeks unless they're showering. Other surgeons say that they don't feel like a bra is necessary, so that's going to be up to you and your surgeon. Another piece of our garment that patients sometimes wear after a tummy tuck is a abdominal binder, which is essentially a compression garment that goes across the belly, and it's supposed to help with swelling. And some physicians have their patients wear them initially and then sort of taper off their wearing of the abdominal binder. I tell my patients I like them to wear the abdominal binder if they have drains until the drains come out, and then they can wear a compression garment they're choosing afterwards, whether it be Spanx or any other commercialized compression garment. And then showering is definitely another area that there's variability depending on your surgeon. I typically allow patients to shower about 48 hours after surgery. There's others that will let them shower sooner, or even later than I let them shower. So that's something that's surgeon dependent. And I'd like to thank you for taking the time to listen to me today. I hope that you've enjoyed our talk, and if you have any questions, I'd be more than happy to answer them.
Great, thank you so much, Dr. Scheuer. There's a lot of really helpful and informative information. We're going to move into the question and answer portion of our talk today. This is an opportunity for you to dial in your questions for Dr. Scheuer. On your GoToWebinar portal that you have popped up on your screen, you will see an area that allows you to ask a question. This is not the area for raising a hand. And it's not the chat bubble. It is actually a specific section that allows you to ask a question. Now, we'll have a limited amount of time to get through those today. However, you will be able to send in your questions with that follow-up email, and Dr. Scheuer will respond to those. So I'll give you just a moment to get some of those questions in. One of the first questions that we have is, how long does it take a scar to fully heal?
That's a great question. Generally, I tell patients, the scar will initially start sort of heal in a more pink-red hue, and this continues to, I guess the scar continues to remodel for a period of months. But I think what most patients care about is, when does the scar actually start to fade? And I tell patients, usually after that 3-month period, the scars begin to fade, but to get a scar that completely, it's at its maximal amount of fading, it's variable between patients. But I say, before you consider a scar to be its absolute, I guess, final color, I'd wait at least 6 months to a year. And I'd say a year is more of the reasonable thing to say, if not longer.
We have another question here. My friend had a hysterectomy with her tummy tuck. Is that possible, and is that safe?
That's a great question. So yes, it is definitely possible, and it is safe. And there's a number of patients that actually choose that option. The main thing is to coordinate that between your OBGYN gynecologist and your plastic surgeon, and make sure that they have spoken beforehand and that everyone's on board. But yes, that's a great question. It is safe to do it, and it is done often.
And we have another question here about showing photos during consultation. So I want to look like I did when I was in my 30s. Is it beneficial to bring in photographs of my body before children?
So I tell patients it's always helpful to have pictures of what they looked like when they were younger. It helps direct the conversation, and it helps, a picture is worth 1,000 words in so many different ways. So I tell patients that to have more information is always helpful. Like I said before, I think it helps direct the conversation, and it gives me sometimes a better idea of what their overall goals are, and it basically just gives me a better idea also of what their history is too.
Wonderful. Well, that is all the time that we have for the questions, but you can continue to send them in. And again, please feel free to email them to us in that follow-up email, and we'll get back to you with those. We wanted to talk to you about your promotional offer. So we actually have some really great promotions coming up this month. We are having our annual fall open house on Thursday, October 19th at 6 o'clock at our Randolph Road location. At the event, we are offering $500 off your surgical procedure and 10% off of all non-surgical treatments, because mommy makeovers, although they are typically breast and body, sometimes you might need to have those tired eyes taken care of with some really great medical grade skincare products or chemical peels, whatever it is that you feel like you might want to need or explore to rejuvenate. But we're also going to be doing raffles, giveaways. We'll have gift bags for everyone. We're going to have lots of live demonstrations of some of our best treatments and services. You'll get to meet Dr. Jack Scheuer and all of our physicians. So those are the two promotions that we are offering. They do expire on January 15th, and we would look forward to seeing you there. So if you'd like to keep in touch with us and, of course, schedule a consultation with Dr. Scheuer, that is a complimentary visit, and you can schedule that by calling our main number or visit our website. We have a wonderful website full of different resources for you to check out as well, where you can sign up for our monthly newsletter, learn about different promotions and specials, of course, get involved with our other Your Best You webinars, and just be in touch with our team in practice. And then you'll want to check us out on our social media pages with Facebook and Instagram. You get to watch demonstrations and hear real candid advice and recommendations from our providers. Thank you again from myself and from Dr. Scheuer for joining us today. We hope that you have gained a lot of helpful information and that we get to see you again in the future, and we look forward to you stopping by at your next Your Best You webinar. Thanks so much.